Hello friends, this is Garima Kuswaf, second year professional medical student at GMCH Bettiah, and in this video I would be talking about how we take history as a medical student, format in which history is being taken by us. Okay, so let's get started with the video. Goes like this. So firstly here you can see what we do is firstly you can present the case as case number 1. Okay, and so we will provide the name of the patient and from where he comes and hospital number or whatever, in which hospital he is being treated, and then the age, sex. Okay, so name, address, age and sex goes firstly. The chief complaint for which he is coming to your OPD, or okay, do you get that? Like, what's the chief complaint of that patient? And then comes the history of present illness. Okay, here you can see history of the present illness. Now the past history, then family history, like if he is being a diabetic patient, so you can ask the family history whether any family member was being diabetic in his family or her family. Okay, and then personal history you will take, and then drug history of whether he is being treated in the past or not. Like drug history, you can ask the drugs which he or she is taken in her past. Okay, and now comes on examination what you see, like general conditions of patient, like build, orientation, decubitus, like what's the physique of that patient, you can just watch. Okay, now the general conditions of the patients. Okay, and the vitals like temperature, pulse, respiratory rate and BP you can check. These are the temperature, pulse, respiratory rate and then the BP. So you have to know what's the normal things, like our temperature, normal temperature is 37 degrees C or 98.6 degree Fahrenheit. Okay, and pulse and respiratory rate 12 to 16 per minute and BP 120 less than 120 upon 80, like goes like this. Okay, 72 beats per minute. And now we will do general survey, like whether he is hydrated or dehydrated, and pallor, icterus, clubbing, cyanosis, pedal edema and generalized lymphadenopathy. These are very good things to go upon. Okay, and this always do these things like pallor, icterus. Okay, you can learn it by, okay, for jaundice, pallor, icterus, clubbing, cyanosis, pedal edema and generalized lymphadenopathy. Okay, and what are the conditions for which we do these things, like for pallor, anemia, and for icterus you can see like when persons watches in your like this. So pallor goes for anemia and icterus for jaundice. Okay, clubbing, cyanosis, when anyone is on mountains or on high altitudes, so you can check whether he is cyanosed or not. Bluish discoloration. Okay, and jaundice is yellowish discoloration. And generalized lymphadenopathy, you can check the lymph nodes. Okay, now comes systemic examination. So you have to go through all the nerves, like 1 to 12 cranial nerves. Okay, and now comes the CVS, like you will check heartbeat, by your stethoscope, and then comes the chest, like symmetry of the chest, and consolidation, whether fluid is present or air is present in case of tuberculosis. Or x-rays you can check. Okay, now here inspection, palpation, percussion, auscultation you will do in last. Inspection, palpation, percussion and auscultation. Okay, and you will provide differential diagnosis in last. So local examination you can do. So this one is the format for medical students. This one is the best gadget they can have. Okay, the best gadget for all of us, for the medicos or for anyone, any doctor, is this, our stethoscope. So whenever there comes auscultation, okay, so while auscultating the chest, or for heart rate or BP, heart rate, sorry, so you can use this device. It's very helpful. So what I was telling that how to take history. So like this goes name, address, age, sex, and now comes the chief complaint, history of presenting illness, past history, family history, personal history, and drug history you will take. And then comes on examination, general condition of patient, build, orientation and decubitus. Vitals you will take its necessary, temperature, pH, respiratory rate and BP. General survey, hydration, pallor for anemia, and icterus for jaundice and clubbing, cyanosis, pedal edema, generalized lymphadenopathy. Now systemic examination for the CNS, CVS and respiratory, you can go while you are checking or you are auscultating, so you will know about the chest and the symmetry, etc. things. CVS, heart sounds. CNS, like nerves, like Babinski sign, etc. you can see. Okay, like upper motor neuron or lower motor neuron lesions, for those lesions. And then you will do inspection, palpation, percussion and auscultation. Percuss, auscultate while by using this stethoscope. Percuss, like put your hands on the body of that patient and just like this. Okay, and like this you have to stroke, and it will provide sounds whether fluid or air is filled in that particular area. And that's all about this video. I hope you like this video, so do subscribe to my channel. Thank you, and be a great doctor in your life.